Nursing 474, Family Health Risks. The weekly learning objectives include use evidence-based practices to support care of families within the community, explain potential barriers to the community health initiatives and how to resolve them, choose interventions appropriate to an identified community health problem, select technologies to inform, communicate, and enhance health knowledge, prepare an evaluation plan for the community health wellness plan. The family as a client unit is basic to the practice of population-centered nursing, and nurses are responsible for promoting healthy families in society. A nation's family health policy is a primary determinant of family health. The family is an important environmental factor that affects the health of individuals, as well as a social unit whose health is basic to that of the community and larger population. It is within the family that health values, health habits, and health risk perceptions are developed, organized, and carried out. Individuals' health behaviors are affected by and acted out within the family environment. The larger community and society, family health habits are developed in the same manner in the context of community norms and values and on the basis of availability and accessibility. The health risks to individual and family health are affected by societal norms. Early approaches to family health risks. Health of families. Early consideration of the family and health and illness focused on three major areas. Number one, the effect of illness on families. Number two, the role of family in the etiology of disease. And number three, the role of family in utilization of services. The health of the nation. Increased attention has been given to improving the health of everyone in the United States. Major public health and scientific advantages have shifted the leading causes of morbidity and mortality to areas that have strong lifestyle and environmental components. A growing body of literature supports the notion that health, lifestyle, and environmental interact with heredity to cause disease. Concepts and family health risk. An examination of several related concepts is necessary to understand family health risk. Pender's health promotion model continues to be useful in research done on families focusing on the desire to promote one's own health using behaviors that increase individual, family, community, and society's well-being, and the desire to protect health using those same behaviors to decrease the probability of ill health and increase active protection against illness and dysfunction in families. Family theorists refer to healthy families, but generally do not define family health. Definitions of healthy families can be derived with any one of the number of frameworks. Within the perspective of the developmental framework, family health can be defined as possessing the abilities and resources to accomplish stage-specific family developmental tasks. Health risk. Not everyone exposed to the same event will have the same outcome. Health risks are the factors that determine or influence whether disease or other unhealthy results occur. Health risk reduction appraisal. Health risk appraisal refers to the process of assessing the presence and degree of specific risk factors within each of the categories that can be associated with an increased likelihood of an illness, such as cancer, or an unhealthy event, such as an automobile accident. Health risk reduction. Health risk reduction is based on the assumption that decreasing the number or magnitude of risk factors will result in a lower probability of the undesired event. For example, substance abuse in adolescents. Risk reduction is a complex process that requires knowledge of the specific risk and the family's perception of the nature of the risk. Family crisis. A crisis exists when the family is not able to cope with the event and becomes disorganized or dysfunctional. The crisis occurs when the demands of the situation exceed the family's resources or coping strategies to adapt or deal with a stressful event. Major family health risks and nursing interventions. Risk to families' health arise in several major areas: biological risk, environmental risk, and behavioral risk. Healthy People 2020 targets areas in health promotion, such as physical activity and fitness, nutrition, tobacco use, use of alcohol and other drugs, family planning, mental health and mental health disorders, and violent and abusive behaviors. Also, Healthy People targets health protection, which includes unintentional injuries, occupational safety and health, environmental health, food and drug safety, and oral health. Healthy People also targets preventative services such as maternal and infant health, heart disease, stroke, cancer, diabetes, other chronic disabling conditions, HIV, STDs, immunization for infectious diseases, and clinical preventative services. And lastly, Healthy People 2020 targets surveillance and data systems to describe age-related objectives. Although most of these objectives are based on risk factors for groups and populations in a variety of categories, some of these factors also relate to and have potential effects on the individual's families, work, school, and communities. Family health risk appraisal is assessment of a family health risk requires multiple approaches to address the many components of risk, including biological health risk, social risk, economic risk, lifestyle risk, and life events. Home visits. This is an important aspect of a nurse's role in reducing health risk and promoting the health of the population has been the tradition of providing services to individual families in their homes. The 5 phases of a home visit are initiation, that's the first contact, pre-visit, in-home visit, termination, and post-visit. That you can also have a contract with families. Contracting is a strategy aimed at formalizing and exploiting the involvement of family in risk reduction. The purpose of a contract can be defined as an agreement between the nurse and client that is focused on enhancing and supporting the client's active role in healthcare by defining who will do what to accomplish health-related goals. Contracting is a learned skill on part of both the nurse and the family. Contracting requires skill, time, effort, and willingness for mutual participation and responsibility. Empowering families. For families to become active participants in their health care, they need to feel a sense of personal competence as well as a desire for and willingness to take actions. If families do not perceive a situation as a problem or a need, offers of help may cause resentment. Providing help can also have negative consequences if there is not a match between what is expected and what is offered. Empowerment reflects 3 characteristics of the family seeking help: access and control over needed resources, decision-making and problem-solving abilities, and acquisition of instrumental behavior needed to interact effectively with others to obtain resources. The goal of an empowering approach is to create a partnership between the nurse and the family, characterized by cooperation and shared responsibility. Community resources. Families have varied and complex needs and problems. The nurse often mobilizes a number of resources to effectively and appropriately meet family health risk reduction goals. General types of resources include government, voluntary, and proprietary organizations that provide health and health-related resources and services to families. Nurses assist families not only by identifying resources, but also by being client advocates and helping families how to learn to use resources. Telehome care, also referred to as telehealth or telemedicine, is an emerging practice that allows clients to communicate with and transfer health information to providers from home, and is a particularly useful option in situations in which ongoing and frequent monitoring is necessary. Family policy, that refers nurses play a role in policy development and implementation. Families are affected by the rules and values of society in general. Vulnerable populations, the LGBT families are at risk. There has been an explosion of visibility for lesbian, gay, bisexual, and transgendered families, and nurses have an ethical obligation to provide culturally competent care to these families. Nurses should provide a safe environment for clients to discuss their sexual orientation and assess family dynamics and special historical barriers within the healthcare system.